Hi, everybody. My name's Jen Benson. I am the State Director for AARP Massachusetts. Today, we are joined by Kathleen Gouveia, who is the Shine Training Coordinator for the Executive Office of Aging and Independence. We're recording this video for your information as Medicare Open Enrollment is coming around. We want to make sure that you have the information you need to make an informed decision. At this point, I'm going to turn it over to Kathleen and she'll go through her presentation. Thank you so much.
Thank you, Jen. So my name is Kathleen Gouveia. I'm the Shine Training Coordinator at the Executive Office of Aging and Independence. Today, I will be reviewing Medicare and mastering the Medicare Plan Finder. So just to discuss some learning objectives here, so we're going to be able to describe coverage under Medicare Part A, B, C, D, and Medigap plans. You're also going to be able to recall Medicare eligibility and enrollment guidelines, describe the services covered under each part of Medicare, recall the two parts or the two types of plans that provide the Part D benefit, and then lastly, how to perform Medicare plan evaluations using the Medicare Plan Finder tool. First, let's get into the Medicare insurance. Medicare is a federal health insurance program that helps with the cost of healthcare in the U.S. Medicare covers some healthcare expenses, but not all. It is not comprehensive or covers the cost of long-term care. Eligibility and enrollment. Who is eligible for Medicare? Individuals who are 65 years or older and a U.S. citizen or permanent residents, for example, green card holder, Cuban Haitian entrants, or someone residing under the Compacts of Free Association. Medicare is available for certain people with disabilities who are under age 65. These individuals must have received Social Security Disability Insurance or SSDI benefits for 24 months or have end-stage renal disease or ESRD or ALS. Most people are eligible for premium-free Part A if they have paid Medicare taxes long enough through their own or their spouse's or ex-spouse's work record. Please note, the increase in age for full Social Security benefits does not affect the eligibility for Medicare at age 65. How does someone enroll in Medicare? Social Security Administration handles enrollment in Medicare Parts A and Medicare Part B. If you are not receiving Social Security benefits, you will need to enroll by making an appointment for an in-person or phone appointment at your local Social Security office or by enrolling online at www.ssa.gov. If you're already receiving benefits from Social Security, you'll get Medicare Part A and Medicare Part B automatically when you're first eligible. Medicare overview. The parts of Medicare. Part A and Part B is what's known as Original Medicare. Medicare Part A is the hospital insurance. Medicare Part B is the medical insurance. Medicare Part D is the Medicare prescription drug coverage. And Medicare Advantage Plans, also known as Part C, combines Medicare A, B, D. On the next few slides, I will talk about each part. Medicare Part A benefits. Medicare Part A covers inpatient hospital care, skilled nursing facility care, home health care, hospice care, short-term nursing home care, medications that are prescribed during an inpatient hospital stay or skilled nursing facility stay that are a part of the treatment plan. Medications that are prescribed during hospice care that are used for symptom or pain relief. It does not cover medications for chronic conditions. Medicare Part B. Medicare Part B covers the outpatient medical care, preventive care, mental health services, physical therapy, etc. outpatient surgical services and supplies, lab tests, durable medical equipment, ambulance services, home health care, and diabetic testing supplies are all covered under Part B. Medicare Part B also covers medications and immunizations. Medications such as injectable and infusible drugs that are given in a provider's office, nebulized solutions and medications used in infusion pumps used at home, oral cancer and anti-nausea drugs, immunosuppressive drugs used to sustain a covered transplant, and insulin that is used in a traditional insulin pump. Medicare Part B also covers immunizations such as influenza, hepatitis B, tetanus, pneumonia, COVID-19, and rabies. Medicare Part D is the prescription drug benefit. It is provided by private insurance companies. It is voluntary, but if someone doesn't enroll and does not maintain creditable coverage elsewhere, they may experience a penalty in the future. Plans vary by medications covered and associated costs. Medicare Part D covered medications and immunizations. Medications. Medicare Part D covers prescription brand and generic medications. This includes drugs, biologics, insulin, and the supplies associated with the injection of insulin. Generally, Medicare Part D plans must cover at least 2 drugs in each therapeutic category. Part D plan formularies must include all medications from 6 protected therapeutic categories. Immunizations. Medicare Part D plans cover shingles vaccines, tetanus, hepatitis B, and RSV. Medicare Part C. Medicare Part C is another way to get your Medicare coverage, often known as Medicare Advantage. You must be enrolled in Part A and Part B in order to join, and coverage is provided by private companies that provide your Medicare A, B, and often your Medicare Part D coverage. Medicare Advantage plans usually are offered as an HMO or a PPO, and you must live in the plan's service area in order to enroll in a Medicare Advantage plan. Medicare Advantage plans may provide additional benefits like gym membership, wellness classes, dental coverage, and vision services. Medigap plans. Medigap plans are supplemental coverage to Medicare Part A and Part B. Medigap plans fill gaps in coverage, such as deductibles and coinsurance or copayments associated with traditional Medicare Part A and B. Medigaps are sold by private insurance companies. You must have Part A and Part B in order to be in a Medigap plan. And in Massachusetts, there is continuous enrollment into a Medigap plan. Medigap plans in Massachusetts. There are 3 standardized products here in Massachusetts that are sold by insurance companies. They offer continuous open enrollment. The different types of standardized plans include Supplement 1, which would give the beneficiary no out-of-pocket cost for Medicare-covered benefits. They generally add foreign travel as well. Supplement 1 is only available to those who are initially eligible for Medicare prior to January 1st, 2020. Supplement 1A is the same as Supplement 1, except the beneficiary pays the Medicare Part B deductible. Lastly, Core, the least expensive of the 3, the beneficiary pays the Part A and B deductibles, and the plan covers the Part B coinsurance and hospital copays. There is basic coverage for each product. It's the same regardless of the company. Plans may offer a few additional benefits, such as foreign travel. You may also use any provider who accepts Medicare, and there are no referrals needed for a Medigap plan. Medicare Part D coverage is not included in a Medigap plan, but someone can add a standalone prescription drug plan. Putting it all together. Your Medicare coverage choices. There are two options for supplementing Medicare. On the left side, you will see what it would look like for someone with original Medicare. Medicare Part A, the hospital insurance, Medicare Part B, the medical insurance, and then step 2, somebody would need to decide if you need prescription drug coverage. If you do, you would enroll in a standalone prescription drug plan. Step 3, decide if you want to add supplemental medical coverage. And lastly, someone can choose to enroll in a Medigap plan. On the right side, we review what it would look like if someone enrolls in a Medicare Advantage plan. Medicare Advantage, or Part C, combines the Part A and Part B medical and usually the Part D prescription drug benefits. If you join a Medicare Advantage plan, you cannot join a standalone PDP, and you do not need and cannot be sold a Medigap policy. The Medicare Plan Finder. Why use the Medicare Plan Finder? The Plan Finder is the best way to compare all prescription drug plans and dozens of Medicare Advantage plans available from different insurance companies here in Massachusetts. The plans change the benefits and premiums from year to year, and new plans may be added each year as well. Drug tier and plan formularies can change from year to year. And when logging into your Medicare.gov account, you can access prescription drug history and can edit or save that information. You can also access claims history. You can compare benefits and costs of current plans to other available options. Creating your Medicare.gov account. Now let's walk through the process of how to create your Medicare.gov account. Please note, current Medicare Plan Finder screens may appear slightly different than those shown in this presentation. Required information still remains the same. Important information about the Medicare Plan Finder. Both an email address and the multi-factor authentication MFA are required for new Medicare.gov accounts. Existing Medicare.gov accounts do not require an email address or an MFA at this time. To begin Medicare account creation, first you will want to go to the Medicare Plan Finder website at medicare.gov/account/login. On the left side, you will see where you can log in. On the right side, you will find the option to create account. Creating an account. Once you've clicked the Create Account button, you will be brought to this page where you will enter your Medicare number and Medicare Part A coverage start date. If you do not have Part A, you can switch to Part B and enter the coverage date start date there. Once complete, click Next. Entering your basic information. On the next screen, you will receive a security notice. Once you have read this, select OK. Then you will continue with entering your basic information. Continuing with entering your basic information. Your basic information includes zip code, name, last name, date of birth, zip code, city or town, email address is required, and the multi-factor authentication is required. Then you will need to agree to the statements. Once done, click Next. Create username and password. Next, you will create a username and password. Be sure to use the username and password guidelines and select a secret question and create the answer. Once done, click Create Account. Account created. Now you can log into your account. If you forgot username, password, or you're unsure if an account exists, click Forgot your username or password. You will be prompted to confirm your identity with your Medicare number, last name, and date of birth. Now I will review navigating the Medicare Plan Finder without logging in, also known as an anonymous search. As a reminder, current Medicare Plan Finder screens may appear slightly different than those shown in this presentation. The required information remains the same. Anonymous search is not recommended in most cases, and this is because there are some limitations. Some of the limitations include you will not be able to access personalized features such as current coverage, LIS or extra help status, and the current list of Medicare drug claims that you have submitted. You will not be able to save a drug list using this type of search. Only search anonymous if you have not yet enrolled in Medicare, are not able or willing to create a Medicare.gov account, or you need to change your extra help status. Now we will go to the Medicare.gov site and click on Find Plans Now. To start, you will need to go to the login page of Medicare.gov. On the right-hand side, you will see the option to continue without logging in. You will need to choose the year the beneficiary or yourself are looking for coverage and enter the zip code. During the Medicare Open Enrollment period, October 15th through December 7th, ensure the coverage year is selected. Select plan type for search. Next, you will need to select the plan type that you are searching for. For example, a Medicare Advantage Plan or Part C, a Medicare Drug Plan or Part D, or a Medigap policy. Then you will click Find Plans. If eligible for assistance, select the appropriate program that you may be enrolled in, and this includes Medicaid, which is MassHealth here in Massachusetts, Supplemental Security Income, Medicare Savings Program, Extra Help, and lastly, I don't get help from any of these programs. Once you have selected the appropriate option, click Continue. Next, you will need to select whether or not you want to see drug costs when you compare plans. In this case, when working with beneficiaries, select Yes to see the drug costs, then click Next. To begin adding drugs, start typing the name and click on it from the list below. Then click Add Drug. If a generic is available, the option to select it will appear. You will need to choose Add Generic or Keep Brand. On the next page, you will need to enter the dosage, quantity, and frequency, and then click Add to my drug list. Please try to use 30-day frequencies, as this provides better accuracy. To enter more drugs, click Add Another Drug. When the drug list is complete, click Done Adding Drugs. Next, you will need to select pharmacies. When selecting pharmacies, you can search by your location, whether it's your street name or zip code. You can also search by pharmacy name. Lastly, you can expand the search area by filtering pharmacy distance. As you select pharmacies, you can click Add Pharmacy. This will add the pharmacy to the bottom of the screen on a blue ribbon. You can then review up to 5 pharmacies at a time. Once you have selected the ones you would like to add, click Done. If you selected Medicare Advantage plans as your search, Add Providers will then appear after you entered your prescription drugs and selected pharmacies to add. You can add multiple providers, which can include nurse practitioners, physician assistants, and doctors. Once you have selected Add Provider, it will include the providers on the blue ribbon on the bottom of the screen. The next screen will bring you to the reviewing or comparing the plan results. This will show the plans available in your county, and it will be listed by the lowest cost drug and premium cost plan based on the search criteria. For this example, we are reviewing one of the prescription drug plans. At the top of the screen, under the name, plan type, and plan ID, you will find the plan contact information. You can then continue to scroll down on the plan details page. You will begin to see the drug coverage details. You will find things like your drug list, the pharmacies that you chose, the yearly drug costs by pharmacy, and the estimated total drug and premium cost, as well as the estimated total monthly drug cost. Under the yearly drug cost by pharmacy, you will see information on the Medicare prescription payment plan. There are 2 links in this box. Learn about the payment option and find out what your drug costs might look like with this payment option. The Learn More about the payment option will bring you to a page that offers additional information, including a short video on the payment plan. The Find Out What Your Drug Costs Might Look Like with this payment option brings out a pop-out screen, which will display an estimated how your monthly bill will be calculated. Continue scrolling for estimated monthly costs. This will display what the estimated monthly cost of your prescription drugs at a particular pharmacy will be. Scroll down and expand the pharmacy for additional drug coverage options. Here, you will see the estimated drug costs at the pharmacies you selected. You can expand to see the copays for each coverage phase for each pharmacy that was selected. Then you can click View More Drug Coverage. Here you will see the cost by drug tier and any restrictions. You can review copays at each pharmacy in each of the coverage phases. Click View More Drug Coverage. Scroll down to see costs by drug tier. You can see drug tier costs for the plan. You can see preferred retail and standard retail pharmacy information if applicable. Next, you can check for prior authorization, quantity limits, and step therapy if applicable. This is important to check because there may be prior authorization, quantity limits, and step therapy, which may cause disruptions in receiving your prescription drugs in a timely manner. On the results page, you can select up to 3 plans to compare. Continue scrolling to view drug coverage. If you would like to see Medicare Advantage plans instead of prescription drug plans, you can go back to the plan results page and click on the link at the upper right that says View All Available Medicare Advantage Plans to switch. Now you will be brought to the results page of Medicare Advantage plans available in your area. When you click on a plan, you will want to review the plan details of the plan you wish to review. The plan details page shows a ton of information. You can click on the overview, benefits and costs, drug coverage, extra benefits, and star ratings, or you can scroll down to each of these sections. You can expand, view more benefits and costs to see additional coverage information. You can continue scrolling to see drug costs. There is a link to resources to assist with prescription costs as well as preferred pharmacies that are highlighted on the screen. Under the yearly drug costs by pharmacy, you will see information on the Medicare prescription payment plan. There are 2 links in this box. Learn about the payment option and find out what your drug costs might look like with this payment option. To learn more about the payment option, this will bring you to a page that offers additional information, including a short video on the payment plan. To find out what your drug costs might look like with this payment plan, brings out a pop-out which may display estimated how your monthly bill will be calculated. Continue scrolling to see detailed costs during the coverage phases. You can expand to see coverage phase details. You can then expand to see costs by drug tier as well as any restrictions. Scroll down to see cost by drug tier. You can see tier drug costs for the plan. You can also see preferred retail and standard retail pharmacy information if applicable. Next, you can check for prior authorization, quantity limits, and step therapy if applicable. This is important to check because there may be prior authorization, quantity limits, and step therapy, which may cause disruptions in you receiving the prescription drugs in a timely manner. Continue scrolling to see extra benefits such as hearing, dental, and vision. You can then click View More Extra Benefits to see additional benefits that may be offered by the plan. Going back to the results page, you can select up to 3 plans to compare at a time by clicking Add to Compare and click Compare. Once you have selected 3 plans to compare, you will see them side by side. Here you can do a comparison, but caution, you will always want to ensure prescription drugs are on the plan's formulary as well as the providers are in network. Continue scrolling for drug coverage. Ensure that all drugs are covered as well as to be sure to check for any restrictions. Next, we will review enrolling in a plan through the Medicare Plan Finder website. To begin an enrollment in a plan, click Enroll. Click Join Plan. You will need to fill out the requested information to complete the enrollment. There are approximately 7 steps. If you are enrolling through a logged-in search, most information will be pre-populated. If not, you will need to provide your Medicare number. Outside of fall open enrollment, October 15th through December 7th, the beneficiary must qualify for and select the appropriate special enrollment period. Enrollments done outside of open enrollment period using a special enrollment period may trigger a confirmation letter from the plan, which must be completed and returned in order to complete the enrollment. You must watch for and respond to these mailings. Special enrollment periods available on the Plan Finder. Important, do not use new to Medicare special enrollment period if you are already enrolled in Medicare Part A. If the beneficiary has Medicare Part A and no longer has an employer group health plan, you will want to use I left coverage from my employer or union, including COBRA, special enrollment period. As you continue scrolling, you will see all the special enrollment periods available. And continue scrolling, you will see all of the special enrollment periods that are available on the system. Thank you. Or if there are any questions, please reach out to us. You can find your local Shine counselor by contacting your local Council on Aging or by contacting Mass Options at 1-800-243-4636 to find your local Shine counselor. You can also call 1-800-MEDICARE for assistance 24 hours a day. Thank you.